title is Patient's Perception and Evaluation of Quality Nursing Care in Bunia and our public and private hospitals in Ituri Province. So, Honorable Professor, Honorable Judge of Panel, and all guests, colleagues, students, lecturers, and forum members, warm regards. We are presenting our research project, as I said below, Patient's Perception and Evaluation of Quality Nursing Care in Bunia and our public and private hospitals in Ituri Province. In this paper, the purpose of our study was to know what was patient's perception towards nursing services. What was patient satisfaction from perspective service gap? And how do they evaluate generally the quality of nursing care in different hospitals of Ituri Province? What was patient satisfaction from perspective service gap, and how do they evaluate generally the quality of nursing care in different hospitals of Ituri Province after the aggression of the eastern part of the Democratic Republic of Congo since 1999? The result of these papers on patients' perception and evaluation of quality nursing care are conducted. The outcomes of the studies are to be used for improving quality of care, planning and frequent evaluation of care in Bunia and Aru private and public hospitals. The findings of this study will help Ituri Province health sector in the future for improving, planning and evaluating quality of care in different hospitals, as so far the views and expectations of patients concerning care have great impact and importance for patient satisfaction. Our aim for conducting this study was to explore the health-related situation from patients' perception of evaluating quality nursing care, and also to get their perspective of satisfaction, which will contribute to better understanding of care, as so far concerns are raised by patients for frequenting public hospitals due to mistreatment in generally, and particularly their dissatisfaction in nursing care in public hospitals, which poses a challenge when nurses are providing care in their respective hospitals. Our aim research question was, what could be patients' perception and evaluation of quality nursing care in Bunia and Aru public and private hospitals in Ituri? And sub-questions we added, what's patients' perception towards nursing services? What is patient satisfaction from perspectives and services gap? How do patients evaluate generally the quality of nursing care in different hospitals of Ituri Province? As general objective of our present study, we would like to have patients' perception and evaluation of quality of nursing quality care in public and private hospitals of Ituri Province. Therefore, we formulated our research hypothesis as follows. Hypothesis nil. Patients' perception, satisfaction and evaluation for services in private and public hospitals are the same. The alternative or hypothesis was the patient's perception, satisfaction and evaluation for services in private and public hospitals are different. The study was conducted from July to September 2016. The sample size consisted of 384 patients admitted either in public or private hospitals of the area. As a methodology, a destructive, quantitative and qualitative research design was adopted for the study. data were collected using a guide questionnaire that comprises of two parts. The first part was about socio-demographic information, and the other part consisted of perceptions, satisfaction, and evaluation of quality nursing care. To assess the validity and the reliability of the questionnaire, a pretest was done with 10 patients selected occasionally. We formulated questions to guide the study. As population of our study, we considered all patients admitted in the related hospitals for a minimum of 3 days, not being seriously ill but mentally alert, male or female, 18 years or older, and can read and write either French, Swahili, Lingala, or can speak and hear the local spoken language. Data collected were analyzed using the SPSS software. The measures of descriptive statistics and inferential statistics test. The result finding presents significant difference of patients' perception, level of satisfaction, and evaluation of nursing care when patients are grouped according to demographical variables. These variables are gender, occupation, level of education, marital status, and age. In addition, we assessed the significant difference when respondents were subdivided according to types of hospital attended. The result of the t-test and ANOVA test showed mixed results. There were some variables for which no significant difference were found, and yet for others, for other variables, significant difference were reached, and we consider only variable which will be significant difference. Considering all variables, as a result, results show that our hypothesis nil, patients' perception, satisfaction, and evaluation for services in private and public hospitals are the same or rejected. Thus, the alternative hypothesis, the patient's perception, satisfaction, and evaluation for services in private and public hospitals are different was considered for 95% confidence interval of difference, and the level of significance set at below 0.01. We justify it by saying, first of all, that evaluation of patients' perception on quality nursing care and their satisfaction is an important element to design the marketing strategy for healthcare services over time. So that such study will enable the managers and doctors of Bunia and Aru public hospitals to identify the points of strength and weakness relative to competitors, and consequently investing the available resources in the dimension that improve the quality of services delivered and patient satisfaction. Secondly, managers and local authorities of Bunia and Aru public and private hospitals should work together in order to have the response. Secondly, managers and our local authorities of Bunia and Aru public and private hospitals should work together to which response to patient request and local patient with high emotion and kindness, and improve tangible assets of the hospitals. By doing so, the hospital will make the patient satisfied with its services, and in turn improve their willingness to recommend the hospital services to others. As a recommendation to end, managers and doctors should build cultural values, renew the operational system, and qualify the managerial and medical staff to offer an excellent and constant level of service quality over time. some recommendations or suggestions to health workers, to future researchers, to the community officials, to central and provincial government, to hospital, local level authorities. The result of research for better understanding of health situation in Ituri Province, and why not in the entire